the results we're having are faster and more complete, more comprehensive, and just amazing patient outcomes.
Well, Cindy, welcome. I'm so glad you're here to be able to talk with you.
Thank you.
Yeah,
It's great to be here.
Yeah. So, Cindy, you are a physical therapist.
Yes.
And so, because you're a physical therapist, you had a physical therapy practice when you came to AMI.
Yes.
Right?
Actually, we just celebrated 30 years.
How many years?
30.
Good for you. 30 years in practice. Good for you. Yeah. And you have a healthy physical therapy practice, right?
Yes, that's been one of our challenges too, is they see my face in our community and they know me as a physical therapist and as a PT practice.
Yeah. So, it's kind of interesting because you have different challenges than a chiropractor who, a chiropractor, 10% of the population go see chiropractors. A chiropractor's staff is used to being, alternative, or let's say not in the medical system, right? Yours is a little bit different in the sense that you would treat the 90% of the patients that probably didn't go to a chiropractor, right? And your team lived in the traditional medical system. And so for you, a little bit of a different angle, which was being able to get your team to embrace a collaborative treatment.
Yes.
Right? So to bring on a medical person, right? I know I'm a physical therapist also. I understand outpatient physical therapy. Physical therapists are phenomenal, right? So they didn't actually choose to work on a team.
Right.
They were the physical therapist, right? So you had a different, which is to actually have your team become embracive of bringing on a medical person, right? And then work with the physical therapist and, possibly bringing on a chiropractor. So it's a different viewpoint, but you're there, right?
Yes.
And you have it. And so,
Yes.
so tell me how, like your patient care with the patients who are being treated with a collaborative team, how is that benefiting your patients?
Well, first of all, it's amazing. It is absolutely amazing. The results we're having are faster and more complete, more comprehensive, and just amazing patient outcomes. I think, we get a lot of referrals from physicians, so we have to honor that, and we have to be very delicate with those relationships.
Yeah.
But we also have the relationship with the patient. And the joke I always say is it's like when you buy a blue minivan, you hear something different or see something different, then all you see is blue minivans. And now I'm hearing my patient intake questionnaire totally differently whenever I see a PT patient, because I'm really realizing all of these patients are telling me, I've been here and tried that. I've been there and tried that. I've been here, and I'm coming to physical therapy and I go back in, a few weeks if I'm not better.
Yeah.
And so they're trying to solve this 30-year problem with 4 weeks of physical therapy. And I'm able to then help them expand to understand that knee isn't getting better because there are so many other mitigating, complicating factors that we are able to find with our AMI connection and our new viewpoint on how we're doing things.
Yeah. You say a really important point there. You're right about that, because I know when you do a patient intake, before as a physical therapist, you would do the intake on, whatever the patient came in for. You get that, right?
Sure.
But now that you've seen the light, right, you realize like, wow, these patients have had this problem for a really long time and they've tried so many things. And what I always say is that every practitioner that sees the patient wants to get the patient better with what they do. But many times a problem that's been around for 20 years, they need more than just a massage or just physical therapy or just chiropractic. It's like they need a collaborative team approach that is able to handle all the problems, right? So that what I always say, the buck stops in these offices, because we're no longer going to kick the can that 6 months later they're in somebody else's office and in somebody else's office. Like, the buck stops with us. Let's get this thing handled. And that's pretty interesting how you had that enlightenment. Now that you do your intakes, you realize
everybody's asking for this kind of thing, and they all are, and they're all experiencing it.
Yeah.
And what's interesting is we're really focused with that team meeting, which is such a wonderful addition to our systems and our programs, and that was brought by AMI, is we're constantly monitoring in a way that we couldn't effectively, systematically do it as a PT clinic for 30 years. We've had great successes, don't get me wrong, and our patients are having wonderful outcomes.
I hear you're a phenomenal physical therapist. So.
Oh, well, thank you. I appreciate that. That's very kind. But I love how this has brought it to a whole nother level. We brought a whole nother game, because with these people, we're able to follow it in the team meeting and tweak it along the way, and be able to do what we need to do to get the whole viewpoint and make the changes very quickly and very systematically, so the patient gets better faster.
Yeah, that is
And we
one of-
get reimbursed for it much better too, which is wonderful.
Oh, that helps too. It does. But that team meeting is one of our one of our systems that we put in for that exact reason, because you have a patient who you might be treating in a physical therapy office in your case, right? And you might say to the doctor, hey, I think they need this, and they might go somewhere else, but there's no collaboration and the conversation and what's being said. It's kind of fractured care.
Exactly.
And that not only do you put the team together to treat, but you put them in the same room every 2 weeks and review the whole case.
Right.
Like, it doesn't get much better than that for a patient outcome. I mean,
exactly.
yeah,
And you can
totally.
make sure that it happened and you can see the results. And
Right.
We had one fellow recently, can I give a patient example? This was just amazing. He had neuropathy, could not feel no sense of sensation, vibration to
Wow.
light touch, anything
Wow.
from the knee down. And he came in for his elbows. And his wife kept prodding him and saying, are you going to tell him about what's really bothering you? And he couldn't walk in his backyard, and he lived out in the country.
Wow.
And so after doing a protocol and working with us on our program, he was able to feel the roots of the trees in his backyard through
Wow.
his shoes, and was able to walk around in his backyard. And that was his big goal. So
That's like
it's just
restoring
life
people's
changing.
life. Yeah, life-changing,
But it
yeah.
wasn't just any one thing. It was a combination of
Yeah.
all of us working together to get him
Well,
the
and if they
results he
came
needed.
in like with just an order for an elbow, you
Right.
wouldn't have been able
Oh,
to do
you
that.
would
but
have
here-
never looked at that.
Right, exactly. Yeah. And I think the one thing also to me is, which you're talking about with the collaboration of the team, is the respect for the different disciplines. When you're
Yes.
in that room every day, team meeting, talking about patients, there is a common respect for the medical person, for the chiropractor, for the physical therapist, who's ever on the team.
Yeah.
Because, we all treat patients, and in a fractured medical world where we know our world, right?
Right.
But you just know that there's other people out there. But I think it actually builds the respect for the different disciplines to work together in the betterment of the patient. That's the key
Absolutely.
thing. Yeah,
Absolutely. We're all on the same team, and we're all looking for the same goal, which is the patient's functional goal and getting them there as quick as we can.
Yeah, patient outcomes. Absolutely. Yeah. Well, thank you, Cindy, very
thank
much
you.
for chatting with me.
Thanks.
Yeah, wonderful.